What exact screenings would be included in this? Is it just simply blood tests, or would it also be a colonoscopy, or what would be done?
It will involve both. It's the physician I've worked with to develop our suggested guideline has started to look at this as a person's approach. We're looking at the firefighter, and within that we can't find the individual cancers, so we have to screen them together. However, we've put some selected notes to start the screening at age 18, which is a blood test for hepatitis B and hepatitis C. Women's health has been much better on the screening perspectives versus men, and we've made some adjustments in there, including self-pap tests to be able to be done for our women firefighters. Melanoma screening at age 25, 7, 8, 10 minutes long, and done annually. Mammography with ultrasound added into it to include those with different tissue densities in order to be able to have better results. Abdominal ultrasound, non-invasive. Fecal occult testing, pennies. Low-dose chest CT is becoming more and more popular because chest x-ray just doesn't give me enough clinical information, and it doesn't have to be done every year. Colonoscopy starting at the age of 35, which is 10 years younger because of the risk that firefighters have. PSA tests for men beginning at age 40, and esophageal cancer also starting at 40. We've since will likely add one for multiple myeloma. The language for that will be just a blood test. So this is built kind of up around the current practice for screening, but provides age adjustments so we can begin that testing earlier than which the nationally accepted is for the general population.
Any thoughts on costs for all of these things? I mean, obviously, earlier in a firefighter's career, there would be less things that would be tested for, and then as they age, there would be more things that would be tested for. But are we talking, thousands of dollars, tens of thousands of dollars?
The couple of quick answers to it is I don't have a price sheet based on the environment there. I know the most expensive test that's going to be on there, and that's going to be a colonoscopy. If it's a true colonoscopy, it involves sedation, hospital preparations. It's not every year. Some of us are in the room have had one. If you get a clean bill of health, you don't have to come back for 10 years. So that price is extended out over a long period of time. And if you're in the system and you find out you have to come back, that's the importance of screening. The other one that currently is out in testing is the esophageal cancer testing tool. That's also expensive. They're currently offering it largely for free as firefighters go. So your costs on every couple year basis would be anywhere from a couple $100 to a low-dose CT scan of $800 to a colonoscopy once every 5 or 10 years at about $2,000. So it's not an annually recurring cost, and the average under that should be less than $1,000 per.
Okay. And, by no stretch of the imagination would it cost the $500,000 that it's already cost the town of Wallingford on firefighter Pirelli.
You're absolutely right. And as a clinician, this process started a little over a year ago. And I'm stunned that this isn't represented by all the large national fire service organizations. They've studied the cancer and carcinogens. Nobody has looked at the screening process. This is something with Representative Piscopo's help. We actually are beginning to have a foothold, and I'm proud to say my fire department let me run with this program, and our first selectman's all in and making sure we do exactly as you said. We're going to start, and we're going to start early.
Okay, great. Again, thank you very much for being here and providing us with some great information on this.